Welcome to Shaw's presentation on celebrating diversity and mental health during Pride Month. Today we will be covering why we celebrate Pride Month. Then we'll watch a few videos on the history of Pride and experiencing mental health in the LGBTQ community, reviewing some notable figures and advocates in queer mental health and healthcare fields, discussing the challenges and recommendations of improving LGBTQ college students' mental health outcomes, then sharing some upcoming events happening all across LA and additional resources in case you're interested in attending and/or reviewing that information. Some of the reasons why we celebrate Pride Month is to acknowledge the progress and culture established by the LGBTQ community and their allies, along with recognizing the ongoing struggles for civil rights, and also to affirm queer and trans identity and visibility. There have been many milestones within the LGBTQ community in the United States, which is why Pride Month is a great way to celebrate the joy and resilience, even in the face of adversity. Along with celebrating Pride Month is the perfect opportunity to educate those inside and outside of the community about the systemic, social, and mental health problems and outcomes of people in the LGBTQIA community. There have been years of advocacy, protests, and safe space development as a form of resistance to the oppressive systems that have threatened and diminished the lives of queer and trans folk. Now we will watch a brief video on the history of Pride Month and the advocacy efforts made over the years.
Pride Month is celebrated in June to honor the struggle for equal rights by members of the LGBTQ+ community and to highlight the progress made. One of the most important moments in this struggle occurred at the Stonewall Inn, a gay bar in New York City. In June of 1969, homosexuality was a criminal offense in most of America. Police raids of gay bars were common, and there had been other uprisings across the country in response to the harassment. The rebellion at Stonewall was a much larger act of resistance, however. Over 5 nights of protests by thousands of people, the struggle for gay rights coalesced into a modern political movement. 1 year later, the first Pride March was held on the anniversary of the Stonewall riots, to demonstrate the solidarity against discrimination and to commemorate the acts of the previous summer. Several gay rights organizations grew from this, and their advocacy helped bring about changes in discriminatory government policies. Other cities joined New York in observing the anniversary, and the observance quickly grew beyond its American origin. Celebrations are now held globally, with millions of participants in parades, parties, and other events around the world.
Tell me how you feel about being here today.
I feel it's beautiful. It's fantastic.
And I've just rejected the mold, and when I rejected the mold, I was happier. And you think that you're happier now that you've realized exactly where your feelings lie?
Indeed, I'm just sorry that it took so long.
Although it had been observed by members of the community for decades, in 1999, President Bill Clinton officially declared June to be Gay and Lesbian Pride Month. In 2011, President Barack Obama expanded the observance to lesbian, gay, bisexual, and transgender Pride Month.
Every year we set aside this month to celebrate the ways that so many lesbian, gay, bisexual, and transgender Americans have helped to make our union just a little more perfect. We honor the countless nameless heroes who paved the way for progress, the activists who marched, the advocates who organized, the lawyers who argued cases, the families who stood by their loved ones, even when it was tough. Every brave American who came out and spoke out, especially when it was tough.
There were also important legal battles won in the month of June by members of the LGBTQ+ community. In June of 2013, in United States versus Windsor, the Supreme Court outlawed discrimination against same-sex couples in determining federal benefits and protections. In June of 2015, the verdict of Obergefell versus Hodges gave same-sex couples marriage equality in all 50 states. In June of 2016, President Obama declared the Stonewall Inn a national monument.
Just like with any person seeking mental health care, When addressing mental health within the LGBTQ community, we have to take into account the entire person and all of their experiences. Unfortunately, due to discrimination, bullying, stigmas, and hate crimes, folks from the LGBTQ community face higher rates of depression, anxiety, and suicidal thoughts. Whether it be rejection from family members or their community, it leaves queer folks with higher rates of isolation, homelessness, low self-esteem, and potential to develop mental illness, especially amongst adolescents and young adults. Simultaneously, there has been a big shift in caring for the mental, social, and physical health outcomes of people in the LGBTQ community. Research efforts on this community have improved so that appropriate and effective resources can be developed. Gender-affirming mental health care has grown, and now providers are more suited to provide appropriate care for their patients. General queer and trans visibility has grown over time as well, which allows healthcare systems to focus on more specific resources, supplies, and services to assist queer individuals seeking medical and mental health assistance. Although progress has been made, advocacy efforts must continue as many LGBTQ plus communities' civil rights are still under major threat. In order to see better mental health outcomes, affirming care must exist and be accessible to all who need it. Now we will watch another video created by National Alliance on Mental Illness, which highlights a few folks' stories sharing their mental health experiences as queer individuals.
Hi, I'm Rochelle, and today I'll be telling you about the LGBTQI experience and some mental health resources. One thing that you should know is that LGBTQI youth are at a greater risk for mental health conditions and suicide. This might be because coming out can be a really scary experience that can cause issues between a youth and the people around them. If you don't feel like you're going to be supported, then coming out can really affect your mental health. It can be really scary if you don't know how someone's going to react.
Growing up a Vietnamese son, growing up in a very Christian community, and then realizing that I was attracted to, other guys, and realizing that part of my identity as a queer person, it didn't match a lot of the narratives that I was taught growing up.
Conversations about mental health in my community are not something that we talk about often. My parents are very traditional Mexican, and I love them, but we also did not share a lot of our emotions growing up.
I held a lot of these sort of heavy emotions in my heart. I didn't talk about them with anybody. And a lot of the self-judgment, that hate that I had growing up turned into depression. And the constant hiding and trying to fit into this mold that really wasn't me developed into anxiety because I was constantly trying to be something else.
There came a point where I was missing school, and my performance in school was really being damaged by the way I was physically feeling and what was going through my head at the time. For me, it was really about being concerned that I was going to be bullied in school because I stood out, and it was something that I feared every single day going to school.
Keeping it in and not telling anyone was definitely affecting my mental health. I was journaling about it a lot, wondering if I was valid, wondering if because no one knew, was I not truly a part of the community? Where did I stand? I wasn't sure if I would be accepted into the community or what would happen. So there's some fear with that. I definitely know some people where they can't tell everyone in their circle just because there is a lot of shame around what they want to express, and it's really hard, and I try to support them in that and let them know that they do have people like me who are out there who are supporting them fully.
It wasn't always so easy for me to, own all these different elements of my life and to talk about my story so freely. And after about 4 years of therapy, I was able to make a lot of peace with my identity. I was able to come out and accept myself fully and give that version of myself the permission to just be him.
I had to come out for mental health, but I also had to come out for my sexual orientation because I am bisexual. So I came out to my friends first. They reacted really well, and actually I feel like this happens a lot of time, but because I came out, a lot of my friends came out to me. I feel like it's a lot of camaraderie with that. Like if one person comes out, it makes someone else feel more comfortable to come out.
Seeing other LGBTQ plus young people and older folks in the same room talking openly about their experiences, that really helped me feel less alone.
Talking to my parents about a lot of what I was going through wasn't easy. When I came out to my dad, he asked me like, son, why were you hiding all this from us? And that was super shocking to me because I'd always thought they didn't want to hear it. They wouldn't get it.
You never know what older generations are going to think, because I think as generations go on, there's more acceptance towards the LGBTQI community, but you never know. Like, even though my parents loved me, I wasn't sure if it would change how they viewed me. I just wanted them to see me the same, but just be honest with who I am, because I was honest with my mental health. I wanted to be honest with like all parts of me. They ended up reacting okay, and there's just questions you have to answer, which can sometimes be exhausting. I think that happens with mental health or gender or sexual orientation, where there's just things you have to get down to the bottom with people. But I think at the end of the day, it's worth it.
My mom had a little bit of a harder time coming to terms, with everything I shared with her. But as she started to see me thrive and just be so happy in these new spaces, she started to get it, and she wanted to learn more about, what I was doing. And yeah, it kind of opened up a whole new door with what I could talk about with my parents, and kind of bringing them along in my healing journey has been priceless.
Being brave is being vulnerable and being able to speak openly about your mental health, about your struggles, and about things you enjoy.
You're not alone in this. The things that you're going through are so, so valid. And I'm so sorry that you grew up in a world that taught you that you needed to be XYZ to be full. But I want you to look in the mirror and just blow that dust off and continue to see yourself a little bit more every day.
If this feels like this relates to you, feel free to go to thetrevorproject.org or NAMI.org to get resources. Thank you so much for listening, and I hope this helped you.
Now we will review some of the notable figures in mental health and healthcare serving the LGBTQ community. Some of these people are queer and trans themselves, while others are mental health and/or gender-affirming care advocates. Now, of course, there are many, many more queer and trans healthcare advocates out there, but these are a few that we will be sharing today. Colvia Carter had many contributions to the LGBTQ community. She was an educator, an HIV/AIDS advocate, an artist, a community organizer, and activist. In 1984, she organized the first DC conference on women and HIV/AIDS. She eventually became DC's state adolescent health coordinator and led many projects focused on HIV/AIDS programs and access to health care. Sharice Davis is a Kansas state representative who has recently reintroduced her legislation, Pride in Mental Health Act, which focuses on improving the physical and mental health of at-risk youth. Legislation like this allows other states and municipalities to follow suit in protecting the LGBTQ community's health. She has also helped kickstart programs over the summer that has to do with wellness for youth and has helped secure funding for other mental health projects. Dr. Julian Watkins is a physician and health justice advocate. Dr. Watkins works for the Bureau of Sexually Transmitted Infections, mainly working with queer people of color. He also makes videos under the title The People's Clinic to help spread awareness of various health issues and provide access to resources and services. We also have Dr. Scout, who is a trans man and the executive director of the National LGBT Cancer Network. He focuses on LGBTQ health equity and has worked to improve mental health access and culturally competent care for queer communities. Dr. Lauren Schechter is a prominent plastic and reconstructive surgeon known for gender-affirming surgeries. He also speaks out about the mental health challenges transgender individuals face and works to put compassionate care into medical systems. Lastly, Kayla Gore is a Black trans woman leading efforts to support transgender and gender nonconforming people facing homelessness and other mental health struggles. She helps provide housing and other resources along with emotional support for those individuals in need. Since queerness and sexuality is known to be a spectrum, some people explore their interests and identities at a younger age, while others later on in life. Many young people who decide to go to college find it a safe and good opportunity to explore their sexuality. Some studies show that 22% of queer college students picked a university in a different city or state to seek a more welcoming environment as compared to non-LGBTQ students. This can be attributed to different factors, including possibly facing rejection from their families or hometowns, having a lack of knowledge and or LGBTQ resources in their hometowns, as well as many others. Despite the progress and efforts to make campuses a safe space for queer and trans students, discrimination, exclusions, microaggressions, homophobia, which is the dislike, hatred, and or prejudice against people who are gay, lesbian, bisexual, asexual, pansexual, non-binary, or anybody who identifies as queer, as well as transphobia, which is the hatred and or prejudice against people who are transgender or anyone who does not conform to society's gender expectations, still all exist in educational institutions. Because of this, it is the academic institution's job to protect these students from further harm from their peers and classmates, faculty, staff, and members of the surrounding community, and also to provide supportive services. Many colleges are adopting gender-inclusive housing and bathrooms, gender-affirming care, and also using chosen name and pronouns to respect those who are non-binary or agender. Campuses are hiring more LGBTQ trained counselors, offering support groups, providing mental health and holistic health care for students, and hosting LGBTQ resource fairs for students to attend and benefit from. Some recommendations to help improve the mental health outcomes of queer college students is by having more inclusive campus policies and trainings for students, staff, and faculty to undergo and follow. Now, with all of that being said, we want you to enjoy Pride Month and continue learning more about the LGBTQ community. There are so many ways to learn how to support ourselves or our loved ones within this community. Here are some events happening across LA all month long. If you're interested in learning more or would like to register for these events, please go ahead and scan the QR codes. Most of these events are free and actually do not require registration, so we hope that you can enjoy them. Now we will watch one last quick video from Mental Health America, encouraging all people from the LGBTQ community to utilize the resources available to them.
Happy Pride Month, everyone. Pride is a time of celebration, reflection, and advocacy for the LGBTQ plus community. I'm Schroeder Stribling, President and CEO of Mental Health America. Here at Mental Health America, we are joining in on the celebration by sharing stories about how being part of the LGBTQ plus community has influenced our mental health. We are taking pride in having open and honest conversations about the connection between identity and mental well-being. It's about celebrating who we are, embracing acceptance, and having courage. So this Pride Month, remember, you are loved, valued, and deserving of acceptance just as you are. Keep shining your light and being true to yourself. You are not alone, and your presence makes the world a brighter and more beautiful place. Explore all of our LGBTQ plus resources at mhanational.org/LGBTQ.
Here are a few different resources for students and supporting staff. These are resources for general health care, mental health care, queer resources for college students, and more. So please scan the QR codes to learn more about them. The Trevor Project is the leading suicide prevention and crisis intervention nonprofit organization for LGBTQ plus young people. They provide information and support for LGBTQ young people 24/7 all year round. If you want to learn more about the Trevor Project and browse the website, scan this first QR code. If you would like to access more information on their hotline, text, and/or chat function, please scan the second QR code. The hotline number is 1-866-488-7386 if you'd like to save the contact now. When using the Trevor Project's text, chat, or hotline function, all of your conversations will remain confidential, and you can share as much as you like or as little as you'd like. This is a list of sources used to help guide this presentation today. And as always, Shaw is here to help our students. This is our contact information. You can call, email, or come visit us if you're interested in therapy or case management services. Also, please follow us on Instagram so you can stay up to date on resources and events. Thank you all so much for watching our presentation. We are wishing you all a safe and wonderful Pride Month.